DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle vaccines. Triangle, protection you can trust.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I am glad that you joined us today. I'm going to be joined by Dr. Mike Apley, and we're going to talk about managing pregnant heifers in the feed yard. It's a topic that comes up from time to time. Thank you for watching the show, and we're going to be back right after this message.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Folks, welcome to DocTalk. Mike, welcome to the show.
Thank you.
Folks, this is Dr. Mike Apley, and he's a professor here at Kansas State University's College of Veterinary Medicine, and he is a boarded clinical pharmacologist. But today we're going to talk about something from his previous life as a practitioner and talk about managing bred heifers or pregnant heifers when they get in the feed yard. And, you know, I kind of did a little bit of review before the show, and about 16 to 20% of the heifers that come in the feed yard are bred, and 10% of those that are bred are what we call long bred or further along in gestation. And I think it's hard for people to understand the concept. 1 out of 5 heifers coming in is pregnant. So what are some things that, why would that be a problem?
Well, it becomes a welfare issue because we want to treat these heifers as well as we can in the feed yard, and we don't want them to calve in the feed yard. And so those long breds are a real challenge because calving in a feed yard with a heifer is not our ideal situation. The short breds, even them, even if they may not calve in the feed yard, when they go to the packing plant, we lose a lot of performance in there because a lot of energy, a lot of feed has gone into producing that calf and into producing the fluids and the uterine tissue and everything else that goes along with that. And so it's not doing well for any of us.
Yeah, when they say when they take out that slunk or when they take out the fetus and the gravid uterus and that's 115 pounds at the time of slaughter in some of these animals that they're slaughtering. So animal welfare, animal health, and decreased performance, which all of them wind up meaning decreased beef consumption and meaning decreased profitability when we look at performance.
Absolutely, and you know, when you're selling on a carcass weight, if you have 10% pregnant heifers in a pen, you think what that does to your yield versus what you put the feed in. It just absolutely destroy your yield. And you know, I still go back as a veterinarian to the primary thing is I hope we can do everything we can that they don't come to the feedlot pregnant, and then when they do, really interested in absolutely minimizing the effect on that heifer of them coming in, which requires some pretty intensive management and a commitment to seeing that management through group after group after group.
Yeah, and I go back to my time in practice. I'm looking at, you know, not only do they're not supposed to be having the calf in the feedlot, but then the retained placentas, the mastitis issues that can happen. But the big one are the downed heifer and the dead heifer. I mean, people don't realize that these heifers can't have the calf. This isn't a cow-calf operation where we're checking them all the time, and it's something that you know, when they aren't assisted and they're in there overnight, it's a big problem. And getting back to guaranteed open heifers and heifers coming in open is going to be a big deal.
It's a really big deal.
All right. Well, let's take a break.
Okay.
Then when we come back, let's get into some of the drugs and the reasons why we use them, and we'll get into some of the programs.
Excellent.
Thanks for watching Doc Talk. Dr. Apley and I will be back right after these messages.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Meet the Veterinarian, brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Dr. Randall Spare is president of Ashland Veterinary Clinic, the largest veterinary practice in southwest Kansas. He focuses on bovine care, especially cow-calf production, and at AABP in 2013, he received the award for developing an outstanding preventative medicine program for beef production. A graduate of K-State School of Veterinary Medicine, Dr. Spare and his wife Michelle have 5 children.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thompson here with Dr. Mike Apley, who is a friend and colleague here at Kansas State University's College of Veterinary Medicine, where we both work with beef cattle and do a lot of production medicine type work with feedlots. And, we were talking during the break about, this is a pretty sensitive issue. And it's one of those that, when people start talking to us about animal welfare and food safety and environmental stewardship, and, it's easy to talk about all the successes because we do such a wonderful job of tending to our livestock and doing the right thing. And, this is a sensitive area, but if we can't be open and transparent about issues that we have and successes that we have, it kind of becomes a one-sided street. So even though this is a sensitive area, we still, it's something that we need to address as an industry. And when you have the opportunity to come on the show, we need to take that opportunity to visit.
Well, and one of the big issues about it is it's a transitional issue between a part of the industry and another part of the industry. And
right.
We do everything we can to keep those really synced up, and what we can do back here that's best for up here, which allows them to do what's best for back here. And so, yeah, it is a really important one to address so that everyone through the whole breadth of the industry is aware of the effect of them.
Yep. So let's talk a little bit about the differences. So, I hear the term shortbred and longbred, and shortbred is not like shortening bred or
no, not at all.
This is some shortbred heifers and some longbred heifers. What's kind of your cutoff there?
About 100 days. And
so 100 days gestation.
Yeah, 100 days gestation. And actually, when a veterinarian's preg checking cattle, it's really a pretty good place to make a break too, because at 90 to 100 days, that uterus disappears way down over there. The cotyledon's getting to a certain size, and so it's one of those sizes where you can kind of come back up and go, oh yeah, it's about 100 days, and then move on from there on up as longbred.
So talk to me a little bit then, difference of what's going on physiologically. Progesterone is the hormone, folks, that maintains pregnancy.
And before 100 days, progesterone is coming from what's called the corpus luteum.
Okay.
And the CL is responsible for generating that and maintaining the pregnancy. And then once we get beyond 100 days, we start to transition where the placenta is creating the large a large percent of that progesterone. So in dealing with those pregnancies, after 100 days, we also have to take back that placenta is also producing progesterone and not just the corpus luteum.
Right. And that's how, I had a group of heifers once that were spayed that had calves. And the reason is they spayed those heifers after they were 100 days in gestation, and the placenta was producing enough progesterone on its own to maintain that pregnancy, even though those ovaries had been removed from the body.
And that's one really important thing for viewers to understand, is that when you spay a heifer, you just take the ovaries out, versus if they take their dog or cat in to be spayed, they take the uterus and the ovaries too, so it's a big difference.
Yep. Well, when we come back, let's get into some of the programs then that we're going to do for some of the shortbred and some of the longbred heifers when we want to abort or preg check and abort these heifers in the feed yard, so that we can prevent some of the issues that we talked about earlier. Hey folks, thanks for watching Doc Talk. Dr. Apley and I are going to be back after these messages. Stay tuned.
This tip brought to you by Batril 100 Enrofloxacin Injectable. The only enrofloxacin labeled for single-dose administration in cattle is also the only enrofloxacin labeled for control of BRD in high-risk cattle. Batril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. For today's tip, we're going to talk about proper vaccine storage and proper vaccine handling. It's very important that we store our vaccine in a refrigerator that you monitor the temperature on, such as this. We have a thermometer in the fridge where we can actually monitor it. You'll be surprised at how refrigerators can fluctuate up and down and get outside of that normal storage range. Also, when you're shoot side, we want to make sure and store our vaccine in a cooler, and we don't want to mix up any vaccine until we're ready to use it. The longer this vaccine's mixed up, the more it degrades over time. So preferably we get vaccine used up within 30 minutes to an hour. It's also very important that when we mix up our vaccine, that we use a properly stored transfer needle, one that's clean and stored well. This makes for a handy storage case to store your transfer needle. Make sure it's always clean and taken care of and stored properly. That's all we have for today.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Batril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Batril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Batril 100, right the first time.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
Your cattle are often at risk of respiratory disease caused by Mycoplasma bovis, but MPB Guard vaccine can help prevent those problems early. MPB Guard delivers proven efficacy against Mycoplasma bovis, even on young calves just 45 days old. It also gives you the convenience of an initial 2-dose sub-Q vaccination series, so help guard your cattle from costly respiratory disease caused by Mycoplasma bovis. Just ask your veterinarian about MPB Guard vaccine.
TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Mike Apley. We're from Kansas State University, hence the Purple Pride, baby. And we're talking about managing bred heifers in the feed yard. Went through the numbers of them, some of the problems, and then how we determine shortbred and longbred. So now let's talk about, let's make the determination. I mean, one thing you can do is just do nothing. And that's...
A lot of things pay consequences, the heifer and the performance. So, yeah.
Right, so if you buy these heifers cheaper and they wind up with some pregnant ones, we can preg check and abort the heifers. Mm-hmm. And so going based on the physiology, talk to me first about what are we going to do with that shortbred heifer?
That shortbred heifer, we're usually very effective with just using a prostaglandin, an injectable drug that goes in and shuts down that corpus luteum, which
Right.
is what's left on the ovary after they ovulate and release the egg. Then the corpus luteum starts, maintains pregnancy, and we can interfere with that pregnancy by administering that drug.
So we're going to give them Lutalice.
Yeah.
Lutalice, Prostamate, those are the, Prostamate's the generic.
PGF2 alpha.
Prostaglandin
is
F2.
generic. And one of the things to keep in mind when administering that, one of the things these prostaglandins do besides our intended effect is they can constrict vessels around them. So even more than usual, it's very important we pay attention to cleanliness of our injection system or the syringes and the needles, that they're absolutely spotless, because that prostaglandin being injected, if not done correctly, you can create some injection site problems if there's any contamination, even more than regular injections. So it can be administered in a safe and effective manner. We just have to really pay attention to our process as we do it.
Cool. Well, so shortbreds, we find one that's bred less than 100 days gestation, one shot of prostaglandin F2 alpha, Lutalice Prostamate, and do it right at the time of processing. Now let's move to that longbred heifer.
Longbred heifer, we're going to have to add some dexamethasone to help shut down that placental contribution and mimic the fetus saying, I'm ready.
And I think that's one thing that's really cool is people, they ask, why does the cow, right before the storm, why do they go have the calf? And not only the fetal cortisone, when that fetus gets too big, it gets stressed and it produces cortisol, and that triggers the cow then to have the calf.
Yep.
And when we have the storm, we get not only the big calf, but then we get that cow getting excited and getting nervous and anxious, and we get the cortisol. So when you give them Dex, that's what we're simulating?
Yeah, and we simulate that, and then those two together are effective. And so, some will go out to like 150 days thinking that that's the window. Some will do everything longer. But as you go past 150, there's a potential for some decreased effect out until the very last part. But as I understand it, when we look at the ones that are longbred, our chances of being effective in the protocol decline as we go longer versus a shortbred. So the longer the pregnancy, when we have a chance to interact with it, the less our chances of being really effective the first time decrease.
Cool. When we come back, we're going to talk a little bit more about the longbred heifers, and we're also going to talk about some of the interactions with respiratory disease. You're watching DocTalk. We'll be back after this message. Hi there, folks. Dr. Dan from K-State. Are you BQA certified? Well, if not, you should be. If you work with beef cattle in any aspect, whether it's cow-calf, stocker, or feedlot, or if you work in an auction market, if you're a 4-H or an FFA member, or if you're ancillary to the beef industry, it's something that you need to do and become familiar with. Beef quality assurance has been around for over 25 years, and it serves as a cornerstone of education to help producers identify management processes that can be improved. Not only have those that are involved with the beef industry embraced BQA because it's the right thing to do, they have also gained through increased profitability. Traditionally, BQA training is offered face-to-face through your state coordinator, and it still is. But today, you can also have this educational opportunity, which can be obtained through the Beef Quality Assurance online training provided by Boehringer Ingelheim Vet Medica. Go to the website bivi-bqa.com, where you can register and become BQA certified at no cost to you between now and October 31st. Also, if you register and become certified between now and October 31st, you can also be entered into a drawing to win some great prizes, including a tailgate package valued at $500. It's a great program. It's been around for almost 3 decades. It's a cornerstone to safe, wholesome, affordable beef. It's Beef Quality Assurance. Get certified today.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Mike Apley. We are here from Kansas State University's College of Veterinary Medicine, and we not only have on the purple shirts, but when we're injured, purple Band-Aids are in vogue now, and probably start marketing those here for too long.
Yep, those will be next commercial.
Anyway, folks, we've been talking about a sensitive topic, bred heifers in the feedlot. And when we left, we were talking about those long-bred heifers. And, you know, we're going to give something Dex. Talk a little bit to how you recommend we do that and when we do that.
Well, usually if we have long-bred heifers, we like to not try to abort them right at initial processing. It's the highest stress time we can possibly have. So we may wait a week or 2 weeks, even though that puts it further along. It allows us to get them past the stress of moving in, getting acclimated to the new environment, getting used to possibly new pen mates, and get them up on feed a little bit, make sure that's taken care of. Because dexamethasone can be a pretty good immunosuppressant. At the dose we use for the heifers, if you give that 3 days in a row, that's a model for downplaying the immune system that's used in research. So one time is important.
Very significant.
Yeah, and even then, when stacked on top of other things, we worry about whether or not we may increase the likelihood of having some respiratory issues or other issues with them. And that brings up another very important point with the long-bred heifers, is that once they have the drugs administered, we have to bring them back and check them, and oftentimes that's in a week, somewhere around there, so they're kept up close where we can do that, or marked in
to
such
make
a way.
sure that they've aborted.
Yeah. Sometimes people, if they're taking the switches off tails, may just leave the long-breds long, and you go out and you get them, and you do them, and then you go back and get them and to check them later. But you have to make sure whether or not they've successfully aborted or not. And then
we used to put a dangle tag inside the lot tag too, that would dangle down, so it was easy for the cowboys to
find them. Yep, because we've got to see them back. We need to check. Probably not going to have 100% efficacy, so we need to identify the ones that didn't, and either know how far along they are and if they need to go early, or if so that we avoid calving in the feedlot, or we address it by maybe another attempt. And then we also need to check if they have aborted that their placenta was expelled okay and everything. So a heck of a lot of management involved in handling these girls right.
Yeah, and you know, also getting those heifers to the point where, you know, where we aren't complicating them with respiratory disease. And you know, sometimes people think that when they give the abortifacient that it's going to happen right now, and it's usually a 48 to 72 hours before we're going to see expulsion of that fetus. So, you know, even if you wanted to keep them up in the hospital pen until that point.
Yeah. So it all comes down to, it's a management intensive process. We're committed to doing it right. Our best way forward would be to not have them.
Yep. Let's get some guaranteed open heifers. Well, folks, that's the end of the show today. Thank you so much for watching us. Mike, thanks as always for being on the show. Remember, always work with your local veterinarian in devising these types of protocols and which types of programs you want to use. And if you want to know more about what we do here at K-State, you can find us on the web at www.vet.ksu.edu. I'm Dr. Dan Thompson. I'm very thankful that you watched the show today. Stay tuned with DocTalk as the few coming weeks, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle vaccines. Triangle, protection you can trust.